Greetings. This is Dr. Bill Wyatt with the American Orthodontic Society, and I have something here I wanted to pass on to everybody. There's the early loss of six-year molars, and a lot of times it's the lower 6-year molars that kids don't take care of properly. They come in real early, and they get decay and they lose them. And in this case, it's a little mixed up with slight class 3 problem that you can deal with. But let me show you how we take care of this situation, especially where you've got to have a wisdom tooth coming in back there, and we show that also. So we'll just take a few minutes here to cover this case, and well, I say it does. It usually takes me a little longer than that, but here's a nice young lady, and she's got a beautiful class 1 relationship over on this side. This is just almost ideal, but yet we've got a crowded problem on the other side. We'll show that here. Now this is the right side. I must have got that backwards there. So that's after we finish the case. Here now we're coming to the point that these molars are in bad shape, and so we extract the lower 6-year molar. This is the way it looked when we finished, and here it was when we started. Here it is on the other side after we finished, and here it was before we actually started the case. And this was 1982 when we went in to do this. Now the upper arch is fine. We straightened it out, but it wasn't when we started. We had an impacted tooth over here, and we're going to open this up and center this out, and you put those teeth in place. So we had to expand the upper arch to do this, and so we did. Now here's the lower arch after we finished in 86, and here is the lower arch when we started in, I think that's 82, something like that. And so this is upside down. So we're going to take these teeth out, and you look at this x-ray on here. All right, here's what I wanted to show you. You get people like this. A lot of times a young person will not take care of this tooth. And so it's rotted out, it's in the nerve and everything. Got a perfect wisdom tooth back here, and they're laying down. And by the way, this is flat down, and we've told you that we've never seen a tooth we couldn't upright. So if it's ankylosed, you got to break it loose, of course. We got several things mixed in here. This is a follicular movement of this tooth to get it off of that, to open the space there to get it through. And so we take these teeth out right here. Now, we pull the lower anterior teeth. That's a big space in here. As we pull the lower teeth back, we're going to hook them to the upper teeth and bring them forward. Now we got to open this space, and so these teeth will be further forward out here when we get through. We're going to pull this forward, and then watch the correction of that molar back there. Now here we put that little spring on there, see, and we've leveled this tooth out, and we're going to pull it forward in here, and we've got room now for this wisdom tooth to come in. We pull this one away from here, and this one's actually good, and we'll just straighten it up in this place. Let me go back and see if you can realize, see that tooth. Now when we start closing that space on the bottom, and we'll move these teeth forward, and we're moving them forward by pulling backward. We're moving these forward by pulling these back, but we're expanding this at the same time. All right, that's back part of the way, and now there we are again. And now with this tooth set it upright, this one back here, we have to put a little lift on it, and we did. We put that little spring, we uprighted the tooth, brought the wisdom tooth up underneath there. We opened this gap and got this tooth to come right down through there. So we're going to have this upper wisdom teeth. We can leave them alone. They don't usually give you trouble. Now we'll go ahead and we pull that in place like that. And those first pictures that we showed there is the finishing of the case. This is 1986. And here it is in 1991. The teeth are still lined up good. The class 1, everything is 22 years of age 22 and 11. She's nearly 23 now. So here are her teeth from 86. How we finished that case out. And you got the midline lined up ideal. She's got some discoloration. That's probably from excess fluoride in these Texas cities in the water, but it's lined up like that. So this is the best way that I know of to take care of early 6-year molar loss down here. You've got the wisdom teeth, pull them up in there. They're not teaching this in the dental schools, at least many of the orthodontic departments don't try to go in there. They'll take the wisdom tooth out and put an implant in or something like that. But this is much better than that. And here's the upper arch now. She's wearing her retainer. You can see where it stays in. And down on the bottom now, these are second molars, wisdom teeth. Second molars, this is a wisdom tooth, this is a second molar. And we pull that up, and I'll bet you that if you took her to 10 different dentists, they'll think that somebody just extracted the wisdom teeth. And so this is what I want to show as something very good that we can do for people. And here it is. You get through with the case. It's lined up good. All this is a class 1. These upper wisdom teeth come in. They're not going to be used, but if something were to happen to something to tooth here, you could bring them forward. So leave them alone unless they're bothering you. If you're giving trouble, you might take them out. But here it is in 1991, and we started this in 82. So this is years later, and this is how it's holding up. And this is the right side, the left side, the upper, the lower. We've got a little crowded relapse down here. I didn't put a 3-to-3 retainer in. I should have had that in there. That would have held that. But this is the young lady, and here she is in 1986. And I don't know, I have the date. This is 91. Yeah, here we go over here. It's in 91. The profile is excellent. And this is 91. And there's the profile in 86. And here's the profile, I think, in 91. Thank you for watching. This is something that we can do for kids or young people that lose 6-year molars. It doesn't, excuse me, it doesn't really matter. They could be 50 years old and lose 6-year molars if they had the wisdom to, and we could still do this for them, see. So this is something I want to pass on. I think we should learn to move the back teeth to the front and fill that in, and you can upright those teeth. Don't think because the tooth's laying down you're going to have to throw it away. Just pick that tooth up. We've shown you in many, many cases how to do that. So thanks for watching, and I'm going to turn this over and hope you'll join us again, and I'll stop and say join our group and subscribe to it. Thank you. Now I'll go ahead and close up. Bye-bye.